This is where we get really into asking the question, reducing your calories or cutting calories or telling patients to cut calories, is that the right thing, right? And that kind of leads us to the number one weight gain myth and why it's holding so many patients from losing weight.
Yeah, so that calorie myth. So many people know about this because it's been driven into us by marketing, by dietitians, by so many people. And it might work for a short time, right? It might work for that short period where you look great for a couple of weeks. The second that they go off of that, they will actually either regain that weight with some extra. So this isn't really a long-term approach. And another thing that you want to think about with the calorie restriction or the calories is 1 calorie of a can of Coke, right? So like 300 calories in a can of Coke doesn't necessarily equal 300 calories of vegetables. Those metabolize differently in our body. So even just that aspect is going to negate that myth of calorie restriction. It's also been shown that even counting calories can slow down our metabolism. This can actually reduce muscle strength and the resting metabolic rate that we discussed earlier here. And this actually reminds me of the patient that I'm going to be talking about in the weight loss summit in the case study. This patient tried counting calories, right? This patient, she had her first child. She gained about 15 to 20 pounds. She did everything to try to lose that 15 to 20 pounds. She did an anti-inflammatory diet. She actually tried 3 to 4 different diets. Counting calories was one of them. She maybe lost like 2 to 3 pounds. The second that she went off of counting calories, she gained it right back. And she actually gained a couple extra pounds from that. We took a look at her hormones, her gut health, and her microbiome. And it wasn't just one hormone. We took a look at all of the different hormones, such as the cortisol, the estrogen, and the progesterone balance, and the thyroid. Once we addressed that, that's when she was able to take that weight off. Her goal was to get back to her pre-baby weight, which didn't work with counting calories. Once we addressed it through the functional health approach, that's when she actually took off all of the 15 pounds that she gained, and she was actually really happy with that. So when we talk about counting calories, it actually doesn't really work long term.
We're essentially asking the question, what are we doing to ourselves when we are doing calorie deficit? This was published in the Medicine and Science in Sport Exercise Journal, and it's called The Effect of Weight Loss on Lean Mass Strength, Bone, and Aerobic Capacity. So what they found was what you mentioned, number one, what you mentioned, Dr. Chill, which is counting calories actually slows down our metabolism because our body is saying, wait a second, I'm not getting enough food here, at least as much as I'm used to be getting. So we must be in a starvation period. So our body slows down the metabolism by readjusting certain hormones in our body. It's really interesting because those changes are long term. They're not just there after the patient goes back to eating their normal diet and the same amount of calories, right? Those changes are long term. Even a year later, there's one study that reported, even a year later, those changes are still impacting that patient's metabolism. When you reduce calories, you start losing your muscle strength and your muscle mass, and you reduce your resting metabolic rate. You're burning less calories every day. And this particular study found on top of that you're also starting to lose bone mass, which increases your risk of fracture in the future. So that's why it's so important. There's multiple reasons for that, why diets just don't work in the long term. There's one particular study that I wanted to talk about, and that's called Physiological and Epigenetic Features of Yo-Yo Dieting. Yo-yo dieting, for anybody who doesn't know what it is, it means that you started a diet, you cut your calories, you start losing some weight because you eat less, but then once you go back to eating normal, you have altered your inner hormones and metabolism, so now you gain weight, right? And then you freak out, you try to lose more weight, you go on a diet, and then again, you stop the diet, you messed up your hormones, your metabolic function, then you gain some weight. So that's what's called yo-yo diet, right? So the study is called Physiological Epigenetic Features of Yo-Yo Dieting and Weight Control. This was published in Frontiers in Genetics Journal, and they reported that weight loss caused by calorie restriction is associated with increased hunger and a strongly increased reward value of food, which means that if I go on diet in which I cannot eat the foods that I like eating, guess what happens to my cravings? They go up through the roof, and I'm not getting what satisfied and releasing dopamine in my brain. This is where, of course, again, we're talking about the long-term impact of dieting is pretty significant. Now, I'm not going to say we're 100% against diets, because specific diets and specific principles of diets could be beneficial to patients, but just that by itself, there's a lot of studies showing that it's not a good thing. One thing to mention about weight gain, there's an involvement of inflammation. When there's weight gain, there's always involvement of inflammation. And we know that because there's many studies that show an association between increased weight gain and increased inflammation. And the second thing that we talk a lot about in our functional medicine training, the fat tissue, the adipose tissue, it's not a silent tissue that just sits there and relaxes with us when we watch TV. It isn't. It's a very, very active, very busy tissue. It actually secretes hormones. It actually secretes inflammatory cytokines. And the more fat tissue we have, the more inflammatory cytokines the patient might be producing. And I know that you've seen a lot of those patients, Dr. Chill. I'm sure that with some of your patients, even if they come in for skin conditions, or other conditions like diabetes, they still all, I would say, want to look better, right? We all do. Now that we understand that there is an inflammatory involvement with this, with obesity and weight gain, we can move on to talk a little bit more about the gut health. So we know that gut health is really, really important. It's one of the 5 or 6 major causes of weight gain. There's a really interesting study. It was published in 2020. The study is called The Influence of the Gut Microbiome on Obesity in Adults and the Role of Probiotic, Prebiotic, and Synbiotic in Weight Loss. And the study showed that the gut microbiome has a significant impact on metabolism and how much energy we burn. What they reported is really interesting. The microbiome actually helps us to keep a healthier weight. And there are 4 or 5 major ways in which our microbiome helps us to maintain healthy weight through the gut-brain axis. When we talk a lot about the gut-brain axis during the functional medicine training, certain species of probiotic, certain species of beneficial bacteria can actually stimulate the brain to feel less hungry, or we feel that we are full and we ate enough. And there's some even that go beyond that and say that when we have sugar craving, that could be stimulated by multiple factors, but our gut bacteria will play a role in that. The second thing is bowel movement. So gut bacteria helps with bowel movement, which helps with elimination of not just the waste, but also environmental chemicals. Microbiome is also important for insulin sensitivity, which means that it helps to get that glucose into the cells so we can burn them. The fourth thing is the gut bacteria actually produces enzymes that we cannot produce because of our genome. So we don't have that coding in our genome to produce certain enzymes, and the gut bacteria can do that. Gut bacteria, for example, can break down dietary fiber and ferment them with certain enzymes, and we cannot. So that's sort of like the symbiotic relationship we have. We want to do patients a service and not a disservice by really educating them about what's truly causing weight gain.
And life is really meant to be lived, right? You don't want to be restrictive your whole entire life. So there's so many other approaches. This is why functional medicine is so great, because there's so many alternatives and options that we can provide for our patients that allows them to be healthy, but still enjoy life and still enjoy the foods that they love.
Exactly. Weight gain is not just the result of eating more or exercising less or aging. Weight gain is a symptom of an underlying dysfunction. And it's really important to understand that. Once I understood that, I was able to open up my eyes and start asking other patients, like patients that come in for diabetes, patients that come in for, they were treating for MS, patients that were treating for thyroid problems, for degenerative conditions, right? For multiple conditions. I started asking them, have you been tracking your weight? Like, have you noticed changes in the last few weeks or months that we've been working with us? And I was so surprised. It was like, so many people said, yeah, like I lost some of my belly, like my belly fat. They came in for something else, but as a result of addressing the underlying causes, right? We talked about one of them could be thyroid, the second one could be gut dysfunction, gut dysbiosis, right? They don't have the right bacteria, maybe they have more of the wrong bacteria. Their metabolism, as a result of addressing all of those, their metabolism improved and it was healthier. Some people, if it was just excess calories that cause us to gain weight, then why do some people eat as much as they want and they still stay the same weight all their life? That doesn't make sense if you think that excess calories is what actually causes you to gain weight. There was an interesting study. What they did is they took nuts. And what they were expecting, the researchers were expecting, is that the people that added nuts to their diet, right, 200, 300 calories just from nuts every day. What the researchers are expecting in the end of the study is that the people that added more calories from nuts, these are calories of fat. They expected that those people that ate more calories will actually gain weight. And what they found out was so interesting. They found out that the people that added nuts to their diet actually lost weight from the baseline where they started the study. So how would you explain that? It doesn't make sense. If you still believe that excess calories is what causing weight gain, take a look at that particular study. It's really interesting. They show very clearly that by adding more calories, of the right calories, you can lose weight. If you're interested in learning about these factors from a functional and an integrative medicine approach, I invite you to join our Functional Weight Loss Summit, where we're going to, together with several experts, dive deeper into the 5 major physiological factors that lead to weight gain in the functional medicine approach. We're also going to look into the specific functional or specialty lab testing to identify those root causes. And we're also going to look into how to create a personalized treatment plan for your patients. We're also going to cover the clinical application of nutritional, herbal, and probiotic supplements for weight loss from an evidence-based approach with specific treatment protocols. This event is live, so you can ask questions and you get all the recordings and handouts and clinical guides with it. You will also learn how to guide your patients towards better health and function so they can feel and look better. Click on the link below and secure your ticket now. I'll see you there.